Drishti is a social enterprise that provides affordable but very high quality eye care in underserved markets. We define underserved markets as regions where there aren't enough providers of eye care. As per the National Program for Control of Blindness, about 1% of the population has cataract in both eyes, which is sometimes termed as avoidable blindness, since the problem can be fixed by a simple surgery. As it stands today, the cataract surgical rates are still not good enough, and there is a backlog of people building every year, and there are more and more people who actually need these care and surgeries. If you think about the fact that 72% of India's population lives in rural areas, and most of our ophthalmologists still tend to be very urban, there is a real strong need for providers to actually go out and service these underserved markets so that people can be provided high quality eye care. After a fairly long stint in the software industry, Anjali and myself were looking to do something with more social impact, and that's when we met Dr. Rajeshbabu, who's our co-founder and partner at Drishti. Dr. Rajesh had studied community ophthalmology in London and was really itching to put his skills to use in India to solve or tackle the problem of avoidable blindness and the need for providing care in underserved markets.
I did my MSc in Community Eye Health from London School of Hygiene and Tropical Medicine. So I was always keen on implementing what I learned in London to the community in India. That's when I started talking to various people, and I met Kiran and Anjali, and then I put forth my ideas in eye care, how to break the barriers to reach more people in Karnataka, rural Karnataka.
When a patient walks in at a Drishti Vision Center today, we begin the process by registering the patient with demographic details, and we try to capture as much possible medical history or information they can provide. Next is they go for a vision and a refraction check. At the end of it, we also capture parameters like eye pressure and fundus photography. All these parameters along with images and the medical record is uploaded, and the ophthalmologist sitting at the hub can access the patient record, and he is prescribing over the telemedicine link. Depending on the ophthalmologist's prescription, the patient either buys a spectacle to improve his vision, or they buy medicines, or they schedule an appointment for the surgery or procedure. We provide a weekly logistic support from the vision centers to the hub. So all the patients who have been prescribed surgeries or procedures are picked up from the vision center on a weekly basis and brought to the hub. All our lenses which we prescribe today are sourced from Essilor. So Essilor has a new group which is called the New Vision Group, which is marketing and selling lenses at very low cost. So we provide a minimal CR39, which is a fiber lens with a hard core, as low as 250 rupees including frames.
Drishti recently raised a round of funding from Lok Capital. Lok is one of the largest social impact funds in India, and the funds that we raised are essentially going to be used to build out the model that we described for the Chikballapur district. This means that we will set up a NABH quality operating theatre at our hospital at Devanahalli. We plan to expand from the 2 vision centers we have live today to about 8 more vision centers to cover all the major towns in Chikballapur. We are also working on building a mobile vision center that will improve the quality of services across the villages in this district and also help us cover more villages each month. To provide affordable eye care across this large area, we require excellent talent which is going to be willing to work in these areas. So Drishti has its own school of optometry where it picks up people from the various areas where we are trying to provide service, provides a training, hires them and then deploys them as part of its centers. In about 18 months, we should have built out all the elements of our model for Chikballapur district and also have a sense of financially if we are able to actually create a sustainable organization. If those pan out to be true, Drishti plans to expand to 4 to 6 more districts in the 2 years beyond that.